Hello, my dear students. I hope my voice is audible. Welcome to Sankalp learning classes. Yes, already we have started the chapter reproductive health in the last class, right? So today we are going to continue this chapter. Already half of the important things, so that is covered in the last chapter, the last class. So today also we are going to continue this. Okay. Yes, what we learned in the last class, just recall what we learned in the last class. Yes. In the last class, we have studied about the different types of the contraceptives, right? So, different type methods used for the contraception, that is natural methods, barriers, then IUDs. So, IUDs and some injectables. So these all are the contraceptives we have studied in the last class. In today's class, we are going to study about the some STDs, means sexually transmitted diseases, and about the infertility and how to overcome the and different techniques that are used to overcome the infertility. Okay, so these things we are going to study in this class. Yes, let us start with the STD. Okay, sexually transmitted diseases. What are sexually transmitted diseases? First, we should know what are sexually transmitted diseases. The diseases that can be transferred from one person to the another person through the sexual intercourse. So, that is called as a sexually transmitted diseases. The diseases transmitted through the sexual intercourse are called sexually transmitted diseases. You know that some diseases they transmit by touching or by touching the utensils which are touched by the patient. So they are the transmittable diseases. But sexually transmittable diseases means transmitted diseases means so they transmit through the sexual intercourse. Okay, or some infections also transmit through the sexual intercourse. So they are called as STDs or STI. So directly we can use STD. Okay. And reproductive tract infections. So that is RTI, reproductive tract infections. Example, gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and HIV that leads to the AIDS. So these are the some sexually transmitted infections or diseases. Okay. And here, how the hepatitis, how these are going to transmit. Hepatitis B and HIV are also transmitted by sharing the injection needles, surgical instruments, etc. So this HIV, so that leads to the AIDS disease. So that is not only transmit by the sexual intercourse, they also transmit by the injection needles, means the injection needle which is used for the deceased person and the same needle which is used to the healthy person, then there is a chance of the transmission of the disease. Okay, then surgical instruments, the instruments which are used for the deceased person, so when it is used for the same instruments which are used for the healthy person, then there is a chance of transmission. Or the blood transmission, when sometimes what happens, there is a proper there is no proper infection of the blood, means checking of the blood is not properly done, then if the infected person's blood transfer to the healthy person, then there is a chance of the transmission of this hepatitis B and the HIV AIDS disease by transfusion of the blood from infected mother to the fetus. And these two diseases, so they may ask how hepatitis B and HIV are transmitted. So not only by sexual intercourse, by transfusion of the blood, by sharing the injection needle, surgical instruments, then from infected mother to the fetus. Except hepatitis B, genital herpes, and HIV, other diseases are completely curable if detected early and treated properly. So here, except the hepatitis B and the genital herpes, HIV. So, except these diseases, other diseases are completely curable. Which are not completely curable? Hepatitis B, genital herpes, and the HIV, which are not curable. And if detected early and treated properly, if other diseases detected early, then it can be treated properly. Okay. So, this is about how hepatitis B and HIV they are transferred other than the sexual intercourse, and which diseases are curable diseases. Okay, so ಇಲ್ಲಿ ಯಾವ್ಯಾವ ಡಿಸೀಸಸ್ ಅನ್ನ ಕ್ಯೂರ್ ಮಾಡಬಹುದು ಅರ್ಲಿ ಸ್ಟೇಜಸ್ ಅಲ್ಲಿ ನಾವು ಫೈಂಡ್ ಔಟ್ ಮಾಡಿದ್ರೆ, ಸೊ ಎಕ್ಸೆಪ್ಟ್ ದಿಸ್ ಹೆಪಟೈಟಿಸ್ ಬಿ ಅನ್ನ ಕ್ಯೂರ್ ಮಾಡಕ್ ಆಗಲ್ಲ, ಜೆನೈಟಲ್ ಹರ್ಬ್ಸ್ ಆಲ್ಸೋ ಅಂಡ್ ಎಚ್ ಐ ವಿ ಏಡ್ಸ್ ಗೊತ್ತಿದೆ. ಸೊ ದಟ್ ಈಸ್ ನಾಟ್ that is not treated properly, right? So here, symptoms of these diseases. So what are the early symptoms? Itching, ಅಂದ್ರೆ ತುರಿಕೆ ಆಗೋದಿರಬಹುದು, fluid discharge and slight pain, swelling, etc. in genital region. So what are the symptoms of these sexually transmitted diseases? So ಯಾವ ತರ symptoms ಇರಬಹುದು? Itching, fluid discharge ಇರಬಹುದು, slight pain, swellings, and in genital region. Absence or less significant early symptoms and the social stigma deter the infected person to consult a doctor. So sometimes these diseases they show the very less symptoms, but sometimes the diseases which are related to the genital area, so there is some barriers, so they are ಈ ಜೆನೈಟಲ್ ರೀಜನ್ಗೆ ರಿಲೇಟೆಡ್ ಇರುವಂತ ಡಿಸೀಸಸ್ ಟ್ರೀಟ್ ಮಾಡ್ಕೊಳ್ಳಿಕ್ಕೆ ಏನಾಗುತ್ತೆ, ಸೊ ದೇ ಆರ್ ಹೆಸಿಟೇಟಿಂಗ್ ಟು ರೀಚ್ ದ ಡಾಕ್ಟರ್ ಟು ಕನ್ಸಲ್ಟ್ ದ ಡಾಕ್ಟರ್. ಓಕೆ, ದಿಸ್ ಲೀಡ್ಸ್ ಟು ದ ಕಾಂಪ್ಲಿಕೇಶನ್ ಸಚ್ ಆಸ್ ಪೆಲ್ವಿಕ್ ಇನ್ಫ್ಲಮೇಟರಿ ಡಿಸೀಸಸ್, PID. What is the full form of PID? Pelvic inflammatory disease, PID, and abortions, stillbirth, ectopic pregnancies, infertility, or cancer of the reproductive tract. So if the person who is suffering from these diseases, so who do not consult the doctor, so that may leads to the some complications, so that may leads to some very uh, uh, that leads to the complications like PID, pelvic inflammatory diseases, or sometimes abortions or ectopic pregnancy. Ectopic pregnancy means ectopic, outside the uterus. Common again ಆಗುತ್ತೆ uterus ಒಳಗಡೆ pregnancy means the embryo will attach, but in case of ectopic pregnancy, the embryo that is attached other than the uterus, it may be fallopian tube or it may be in the ovary, so that is the ectopic pregnancies, and the infertility or cancer of the reproductive tract. So when the person detect the symptoms, significant early symptoms, so he should consult the doctor, otherwise it leads to the some complications. Okay. So how we can prevent the sexually transmitted diseases? How we can prevent the sexually transmitted diseases? Avoid the sex with unknown partners or multiple partners, or always use the condoms during the coitus. In case of doubt, go to the qualified doctor for early detection and get complete treatment. So early detection is better. So otherwise it may leads to the complication. So these all prevention method we can take to control this disease. Yes, these are the some sexually transmitted diseases here, syphilis, and this is the gonorrhea, and trichomoniasis, chlamydia. So these are the some diseases. Let us study about the some diseases which are related to the sexually transmitted diseases. Okay, so bacterial vaginosis. So here, what are the characteristics of this bacterial vaginosis? Here, BV, shortly it is called as BV. It is a disease of vagina caused by excessive growth of bacteria with Gardnerella vaginalis. Okay. So the bacteria which cause the bacterial vaginosis, so commonly in female. So this what we are studying, that is commonly in the female. So common symptoms include increased vaginal discharge that often smell like a fish. The discharge is usually white or gray in color. Burning with urination may occur. Itching is uncommon, and occasionally there may be a no symptom. Sometimes this disease that will not show some symptoms. It also increases the risk of early delivery among the pregnant women. So this disease which is related to the females, okay, bacterial vaginosis which is related to the females, and the disease which the bacteria which is responsible for this disease, and what are the characteristics of this disease. Chlamydia. What are the symptoms of chlamydia? So here, this chlamydia, so sometimes, so there is no symptoms at all, and sometimes there is a abnormal discharge and burning or itching, abdominal pain. So these are the common symptoms of this chlamydia disease, and an estimated 2.8 million infections occur annually in the US. So ಈ ಕ್ಲಮಿಡಿಯಾ ಅನ್ನುವಂಥ ಡಿಸೀಸ್ ಸಮಟೈಮ್ಸ್ ಯಾವುದೇ ಒಂದು ಸಿಂಪ್ಟಮ್ಸ್ ಅನ್ನ ತೋರಿಸೋದಿಲ್ಲ, ಬಟ್ ಕಾಮನ್ಲಿ ಸೊ ವಾಟ್ ಆರ್ ದ ಸಿಂಪ್ಟಮ್ಸ್ ವಿ ಕ್ಯಾನ್ ಸಿ ಅಬ್ನಾರ್ಮಲ್ ಡಿಸ್ಚಾರ್ಜ್, burning or itching, and the abdominal pain. Here, what are the symptoms? Here, when chlamydia symptoms to appear, they typically present themselves 1 to 3 weeks after exposure to the bacteria. So here, the chlamydia, so when these symptoms occur after exposure of 1 to 3 weeks of that bacteria. For women, symptoms may include abnormal vaginal discharge or painful or burning sensation during the urination. And if the infection spreads, women can experience abdominal and pelvic pain, fever, nausea, and bleeding between the periods, and pain during the sex. So these all are the symptoms of this disease. So when the affected person may, so in the affected person we can see these all some symptoms. For men, symptoms may include painful burning sensation during the urination and unusual discharge from the penis. For both men and women, symptoms are rectal infection may include the rectal pain or the bleeding. So this is for both male and female, that is having the different symptoms. So here, pain during the urination or unusual discharge from the penis or vagina. So these all are the common symptoms, but so this chlamydia disease that may occur in both male and the female. So that is about the chlamydia disease. Gonorrhea. What are the symptoms of gonorrhea disease? Here, especially in case of women, gonorrhea symptoms are usually undetectable. Here, in left untreated, gonorrhea can spread into the uterus or fallopian tubes, causing the pelvic inflammatory disease. So this gonorrhea that may cause the that may spread into the uterus or fallopian tubes, and pelvic inflammatory diseases, so that may lead to the pelvic inflammatory diseases, and PID might lead to the infertility and increased risk of ectopic or tubal pregnancy. So here again there is a word, infertility and an increased risk of ectopic and tubal pregnancy means already ನಾನು ಹೇಳ್ದೆ ಅಲ್ವಾ, ಕಾಮನ್ ಆಗಿ ಫರ್ಟಿಲೈಸೇಷನ್ ಆದ್ಮೇಲೆ ಏನಾಗುತ್ತೆ, ಯೂಟರಸ್ ಅಲ್ಲಿ ಇಂಪ್ಲಾಂಟೇಶನ್ ಆಗತ್ತೆ ಅಲ್ವಾ, ಯೂಟರಸ್ ಅಲ್ಲಿ ಏನಾಗುತ್ತೆ, ಫೀಟಸ್ ಗ್ರೋತ್ ಆಗತ್ತೆ. ಬಟ್ ಎಕ್ಟೋಪಿಕಲ್ ಏನಾಗತ್ತೆ ಅಂದ್ರೆ, ಸೊ the fertilized zygote, that is start to develop in the fallopian tube or in the ovary, so that is called as the ectopic pregnancy. Okay, in men, painful urination or yellow or green tinted white discharge from the penis, and less common symptoms include the itching and the burning around the urethra, so that is in the male. Other symptoms are often mild and unnoticeable. An untreated gonorrhea infection can lead to the serious complication like intense testicular or scrotal pain in the male. Okay, so this is the symptom of gonorrhea, very important, which is the sexually transmitted disease. Herpes virus, symptoms of herpes virus here, genital herpes. Genital herpes. So that, what are the symptoms of this disease? Symptoms of genital herpes include vesicles, sores or lesions, blisters, painful ulcers, itching and burning in the genital area, anus or upper thighs. So small vesicles or small lesions, blisters like this. So these are, you can see small lesions, blisters. So they may occur in the genital area, not on the other body surface. So here genital herpes that occur in the genital area or the anus or the upper thighs. Approximately two-thirds of the people with genital herpes do not experience the symptoms or symptoms that are so mild and they are mistaken for other skin condition. So here genital herpes, mainly the vesicles or sores or the blisters, they may occur they may observe in the genital area, but many people, they don't know about this, they do not experience the symptoms or have the symptoms that are so mild and they are mistaken for the other skin conditions. Here herpes simplex, the another type of disease. Here can read this here. Symptoms begin 2 to 30 days after the infection and flu-like feelings will be there, and small painful blisters on the sex organs or the mouth. So these are the some symptoms of the herpes simplex disease. Syphilis. What are the symptoms of the syphilis disease? Here you can observe the symptoms of the syphilis disease here. Flu-like symptoms, swollen lymph glands in the neck and armpit or groin, sore throat, headaches, fatigue, internal organs damaged like brain, nerves, eyes, heart, blood vessels, liver, bones and the joints, loss of motor skills, paralysis, numbness and gradual blindness, mental illness. So these all are the some characteristics, some symptoms of the this disease. Okay, so that is the character symptoms of the syphilis disease. Then symptoms of trichomoniasis here. So this is the parasite, pear-shaped parasite. So you can see the disease causing organism here. So commonly caused by protozoan. This trichomoniasis, that is the protozoan. Okay, symptoms in females that includes the itching in the genital area, discharge from the vagina, painful urination. So in case of males ಅಲ್ಲಿ ಯಾವ ರೀತಿಯಾದಂತ ಒಂದು ಸಿಂಪ್ಟಮ್ಸ್ ಇರುತ್ತೆ ಅಂದ್ರೆ ಯೂಶುವಲಿ ನೋ ಸಿಂಪ್ಟಮ್ಸ್ ಬಟ್ ಇಟ್ ಕ್ಯಾನ್ ಬಿ ಕ್ಯೂರ್ಡ್ ವಿತ್ ಪ್ರಿಸ್ಕ್ರೈಬ್ಡ್ ಮೆಡಿಸಿನ್. ಸೊ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಫಾರ್ ಯುವರ್ exam. Then one more disease, genital warts. So what is this genital warts? So these genital warts are soft growth that appear on the genital. They are sexually transmitted infections caused by the certain strains of human papilloma virus, HPV. Very important for your exam. And genital warts can cause pain, discomfort and itching. They are especially dangerous for the woman because some types of HPV can also cause the cancer of the cervix and the vulva. So very important about the HPV virus. And this genital warts, that is the viral disease. Okay, so you should know which one is the viral disease, bacterial disease and the protozoan disease ಯಾವುದು ಅಂತ ನಿಮಗೆ ಗೊತ್ತಿರಬೇಕು. Then HPV is the most common of all STIs. Men and women who are sexually active are vulnerable to complications of HPV, including genital warts. So this is the one more disease, pubic lice. So lice that infect the genital region in both men and the women. So this is also type of STD. And the common symptoms of genital warts, so that already we have studied. Small bumps can feel hard or soft. So you can see the image here. So here more people, they do not have the symptoms of the genital warts. Okay, so here, so these images, so that you can see the genital warts. So genital warts, so ಅಲ್ಲಿ ಏನಾಗಬಹುದು, cervix ಅಥವಾ vulva region ಅಲ್ಲಿ, so if the virus is affected, that leads to the cancer. Yes, so this is about the some diseases, sexually transmitted diseases and their characteristics. So for your competitive exam, you have to study in detail about these diseases. Okay, so next thing is infertility. What is infertility? What is the meaning of infertility? So here, according to the definition, if the it is the inability to conceive or produce the children even after 2 years of unprotected sexual cohabitation. So if the person, they are not able to produce the children even after they are doing the unprotected sexual intercourse. Okay, so that is called as the infertility. Then what are the reasons for infertility? So what are the common reasons for infertility? The reasons for this may be physical. So there may be some physical uh, reasons or congenital diseases or drugs, immunological or even psychological problem. Okay, so infertility, that there is a many reasons for the infertility. It may be a physical or psychological or immunological, or sometimes due to the drugs or sometimes diseases. So these all are the main reasons for the infertility. But the infertility that can be treated in the clinics, infertility clinics, using the assisted reproductive technologies. So the persons, those who are not able to produce the children naturally, some clinical treatments, so they are used to produce the children. Okay, so that is called as assisted reproductive technologies. ART anta karitare idanna, ART. So ನೆನ್ಪಿಟ್ಕೊಳ್ಳಿ, ART, that is the assisted reproductive technologies. So that is used to treat the infertility. Here, the technology is used to correct the infertility problems, that is called as ART, assisted reproductive technology. Here, the first type of assisted ART, that is IVF. What is IVF? In vitro fertilization. IVF, that is nothing but the in vitro fertilization. What is in vitro fertilization? How it can be done clinically? So let us study. So here, so this is the brief history about the IVF, how it is started, and Subhash Mukhopadhyay. So 16 January 1931 was the physician from Hazaribagh, Bihar. So who created the world's second and India's first child using the in vitro fertilization, IVF. Please know the full form, that is in vitro fertilization. And Durga, who was born 67 days after first IVF baby in the United Kingdom. The first IVF baby, in vitro fertilization, IVF baby born, so that was first born in United Kingdom. Okay. After that, in India, the IVF baby named Durga. So in 3 October 1978, Kanupriya Agarwal was born. So that is the success stories of the IVF. So in the 1970s. Okay. So 1978 ಅಲ್ಲಿ ಸೊ IVF ಅನ್ನ ಆ ಒಂದು 19th ಸೆಂಚುರಿ ಇಂದನೂ ಕೂಡ ಸೊ ಏನ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ, ಸೊ ದಟ್ ಈಸ್ ಪರ್ಫಾರ್ಮ್ಡ್. ಓಕೆ. So that is about the Subhash Mukhopadhyaya, how it was started and how he achieved this. Okay. Here, so let us study how IVF can be done. In vitro means fertilization outside the body. Commonly what happens? So this is the uterus. Just imagine. So in the normal condition, what happens? Ovary. And just imagine this is the uterus. Okay. So in the common condition, commonly fertilization occur in the fallopian tube, and after that it is transferred, implanted in the uterus, where the growth of the baby takes place inside the uterus. But here, in vitro fertilization means the fertilization that occurs outside the body. Fertilization that occurs outside the body. It is often used when women's fallopian tubes are blocked or when man produce too few sperm. So it is also when it is used when IVF is preferred. IVF ಅನ್ನ ಯಾವಾಗ ಮಾಡ್ತಾರೆ ಅಲ್ವಾ? IVF. So it is a technique used to treat the infertility when the female fallopian tubes are blocked. So ಇಲ್ಲಿ fallopian tube ಅಲ್ಲಿ block ಇದೆ, where the sperms not able to reach the egg. ಇಲ್ಲಿ fallopian tube ಅಲ್ಲಿ block ಇದ್ರೆ ಏನಾಗುತ್ತೆ, sperms are not able to reach the egg, and there is a no chance of fertilization ಅಲ್ವಾ? ಫರ್ಟಿಲೈಸೇಷನ್ ಆಗ್ಲಿಕ್ಕೆ ಚಾನ್ಸ್ ಇಲ್ಲ. ಆ ಒಂದು ಕಂಡೀಷನ್ ಅಲ್ಲಿ ಯೂಸ್ ಮಾಡ್ತಾರೆ. Or when a man produces too few sperm. So when the man ejaculates the sperm, but they are too few and they are not able to reach the fallopian tube. So if there is a problem in man also, this IVF is used. Doctors treat the woman with the drug that causes the ovaries to produce the multiple eggs. Once they mature, the eggs are removed from the woman. So when the doctors, they treat the woman, so that produces the egg. Okay. So when the egg is produced, the eggs are removed from the woman. So here these eggs they are removed from the woman. So now the eggs are outside. Okay. And they are put in the dish in the lab along with the man's sperm for the fertilization. So in the lab, this ovum treated with the sperm, man sperm, that is collected from the male, and after 3 to 5 days healthy embryos are implanted in the woman uterus. So when fertilization occurs, the zygote, so that will develop into embryo, and this embryo, so that is transferred to the uterus. IVF, ET, commonly what we write, IVF, embryo transfer. Okay, so this embryo is transferred to the uterus. So this is called as the in vitro fertilization. Here you can here ovarian stimulation, hormone therapy is done, and here eggs are collected. So egg pickup means egg produced by the ovary and that is collected. Okay, so your eggs are collected, and in the here these are the eggs, and sperm is also collected from the male, and that is also injected to the for the fertilization. Here where the fertilization occurs, so you can see the of egg that is treated with the sperm, then fertilization occurs and embryo will develop, and this embryo again transferred to the uterus. Here you can see again the embryo is transferred to the uterus, that is called as the in vitro fertilization and the embryo transfer. So IVF, that is followed by the, so when it is performed, very importantly, when the IVF is performed, wife or the donor and the sperms from the so when the female is not able to conceive, or there is a block in the fallopian tube, or there is a few sperms are produced by the male, then this technique is performed, and this is followed IVF, in vitro fertilization, that is followed by the embryo transfer. ಇಲ್ಲಿ IVF in vitro fertilization ಆಯ್ತು, ಅದಾದ್ಮೇಲೆ ಏನ್ ಮಾಡ್ತಾರೆ, ಎಂಬ್ರಿಯೋ ಪ್ರೊಡ್ಯೂಸ್ ಆಗಿರೋದನ್ನ ಏನ್ ಮಾಡ್ತಾರೆ, ಯುಟೆರಸ್ ಗೆ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡ್ತಾರೆ ಅಲ್ವಾ. So that is the IVF, and it is also called as test tube baby program. So embryo transfer. So embryo transfer, here zygote intrafallopian tube transfer, that is the ZIFT, transfer of the zygote or early embryos with up to 8 blastomeria into the fallopian tube. So here one more technique is there, that is the ZIFT, ZIFT. Here zygote intrafallopian tube. What is this zygote intrafallopian tube? Here just imagine this is the uterus, this is the fallopian tube. Okay, so outside the body fertilization occurred and there is a formation of zygote. So here zygote up to 8 blastomere stage. So when the zygote, so that will undergo the cell division. So when it is in a 8 blastomere stage, it is transferred to the fallopian tube, not to the uterus. Okay, so it is transferred to the fallopian tube. So then it is called as a ZIFT, that is zygote intrafallopian tube. When the zygote is transferred to the fallopian tube up to 8 blastomere stage, that is the ZIFT. Okay. And sometimes this embryo transfer, that is intrauterine transfer, transfer of embryos with the more than 8 blastomere into the uterus, and embryos formed by in the in vivo fertilization. So fertilization within the female is also used for such transfer to assist those females who cannot conceive. Here sometimes the the zygote with more than 8 blastomere stage. So zygote that is more than 8 blastomere stage, that is directly transferred to the uterus. Direct agi uterus ಗೆ transfer ಮಾಡೋದನ್ನ intrauterine transfer ಅಂತ ಕರೀತಾರೆ. IUT, intrauterine transfer. What it is here, that is the embryos with more than 8 blastomere stage, that is transferred. So 8 blastomere stage ಜಾಸ್ತಿ ಇರೋದನ್ನ ಇಲ್ಲಿ ಯುಟರಸ್ ಗೆ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡ್ತಾ ಇರೋದು, that is the IUT. Okay, yeah, the same zygote intra-fallopian transfer, or here the fertilization occurs in the laboratory and the young embryos transfer to the uterus. Here you can see in the diagram. So fertilization occur in the outside in the lab and zygote with the 8 blastomere stage. 8 blastomere stage ಇರೋದನ್ನ ಎಲ್ಲಿ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ? So that is the zygotes are transferred to the fallopian tube, not to the uterus. So this is the uterus and this is the fallopian tube ಅಲ್ವಾ? So ಇಲ್ಲಿ ಏನ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ? fallopian tube ಗೆ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. That is nothing but the zift, ZIFT. Okay. And one more technique, that is gamete intrafallopian tube, that is zift. Gift, okay, zift, not zift, gift. Gamete intrafallopian tube. Here, what is gift? Transfer of an ovum from the donor into the fallopian tube of another female who cannot produce the ovum but can provide the suitable environment for the fertilization and the development. So here, the gametes, for example, if the female is not able to produce the gamete, ovum, okay, ಈಗ female train ಆಗ್ತಾ ಇಲ್ಲ, ovum production ಆಗ್ತಾ ಇಲ್ಲ, ಆಗ ಏನ್ ಮಾಡ್ತಾರೆ, ಡೋನರ್ ಇಂದ ಗ್ಯಾಮೆಟ್ ಅನ್ನ ತೆಗೆದುಕೊಂಡು, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಫ್ರಮ್ ದಿ ಅನದರ್ ವುಮನ್ ಇಂದ ಗ್ಯಾಮೆಟ್ ಅನ್ನ ತೆಗೆದುಕೊಂಡು ಏನ್ ಮಾಡ್ತಾರೆ, ಸೊ ದಟ್ ಈಸ್ ಟ್ರಾನ್ಸ್ಫರ್ ಟು ದ fallopian tube. Yeah, so just imagine this is the uterus. ಇಲ್ಲಿ ಏನಾಗುತ್ತೆ, gamete that is transferred to the fallopian tube, that is called as gamete intra-fallopian tube. When it is performed, that is very important. ಇದನ್ನ ನೋಟ್ ಮಾಡ್ಕೊಳ್ಳಿ, ಯಾವಾಗ ಇದನ್ನ perform ಮಾಡ್ತಾರೆ, gamete intra-fallopian tube. So that condition is very important, okay? Here you can see the technique here, ovary. So that is the fallopian, this is the ovary and fallopian tube here. So it is the procedure in which eggs and sperms are placed in the fallopian tube via laparoscopy. Fertilization may take place in the fallopian tube. So ಇಲ್ಲಿ zift ಅಲ್ಲಿ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ, with gift, sperm and eggs are placed in the fallopian tube or to allow the fertilization in the natural side. The woman must have at the least one normal open fallopian tube. So ಇಲ್ಲಿ ಏನ್ ಮಾಡ್ತಾರೆ, gift ಅಲ್ಲಿ gametes ಅನ್ನ, egg and the sperm, so ಇಲ್ಲಿ fallopian tube ಅಲ್ಲಿ from outside they are injected. So ಇಲ್ಲಿ gametes, ovum ಅನ್ನ, if the female is not able to produce the ovum, then the ovum is transferred to the fallopian tube from the outside, and the sperm ಅನ್ನ ಏನ್ ಮಾಡ್ತಾರೆ, sperm ಅನ್ನು ಕೂಡ fallopian tube ಗೆ inject ಮಾಡ್ತಾರೆ. So then the fertilization occurs naturally. ಇಲ್ಲಿ ಏನಾಗುತ್ತೆ, fertilization natural ಆಗಿ ಆಗುತ್ತೆ gift ಅಲ್ಲಿ, GIFT, gift, gametes ಅನ್ನ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡ್ತಾರೆ and fertilization occurs normally, okay? So that is the gift. And ICSI. So what is this ICSI? Intracytoplasmic sperm injection. So what is this ICSI? It is often used for the couples in which these are serious problems with the sperm. Sometimes it is also used for older couples, for those who have failed IVF attempts. In ICSI, a single sperm is injected to the mature egg, then the embryo is transferred to the uterus or the fallopian tube. Here, what is ICSI? Here, single sperm from the partner is injected directly into an egg from the female partner. So after the fertilization, the embryo is implanted into the uterus. So ಇಲ್ಲಿ ಏನ್ ಮಾಡ್ತಾರೆ ಅಂದ್ರೆ, the sperm that is injected directly into the egg ಗೆ inject ಮಾಡ್ತಾರೆ, sperm ಅನ್ನ egg ಗೆ inject ಮಾಡಿ, the zygote that is transferred to the uterus, okay? So that is the intracytoplasmic sperm injection. So here So these are the sperm and this is the egg. Directly the sperm is injected into the egg. Okay. So that is intracytoplasmic sperm injection, ICSI. Then one more technique, that is IUI, intrauterine insemination. What is IUI? Here, intrauterine insemination. So ICSI different, IUI. Women with adequate ovulation below 40 years without damage to the fallopian tube can treated with the IUI. Here, women superovulated by gonadotropins, multiple eggs will develop and IUI is time to coincide with the ovulation. Using this thin soft catheter here, the sperms are injected here. Okay. So the female, she is able to produce the egg. Eggs are produced from the ovary. So ovary with the eggs are produced here. But the male partner who is having the less sperm count or sperm motility, then the sperms are directly injected here. Okay. So then the sperms, they fertilize with the egg, and after the fertilization, it will enter to the uterus. That is IUI, intrauterine insemination. Here, intrauterine insemination is form of treatment where sperm are inserted into the uterine cavity around the time of ovulation. So when these sperms are injected, sperms ಅನ್ನ ಯಾವಾಗ ಇಂಜೆಕ್ಟ್ ಮಾಡ್ತಾರೆ? Sperms are injected during the time of ovulation. Ovulation ಯಾವ ಟೈಮಲ್ಲಿ ಆಗುತ್ತೆ ಅಲ್ವಾ? ಆ ಒಂದು ಟೈಮಲ್ಲಿ ಏನ್ ಮಾಡ್ತಾರೆ, ಸ್ಪರ್ಮ್ಸ್ ಅನ್ನ ಫ್ರಮ್ ಔಟ್ಸೈಡ್ that is injected, and IUI can be carried out in the natural cycle without use of the drugs, or the 5 ovaries may stimulated with oral anti-estrogens or gonadotropins. Okay, sometimes ಏನ್ ಮಾಡ್ತಾರೆ, using the drugs, ovaries are try to produce the eggs. Ovaries in the egg produce ಮಾಡ್ಲಿಕ್ಕೆ try ಮಾಡ್ತಾ ಇರ್ತಾರೆ by using the drugs. So by using the IUI, means intrauterine insemination, the sperms are directly injected to the vagina during the ovulation time. Okay, when the eggs are produced, so these sperms are injected. So that is the IUI. Yes, so it is performed like this. So this is the uterus, fallopian tube, these are the ovaries, and so this is the insemination syringe. Okay, so this is how IUI is performed. Here, artificial insemination technique. So what is AI? Artificial insemination. The semen collected from the husband or the donor is artificially introduced into the vagina or the uterus of the female. Artificial insemination into the uterus is known as intrauterine insemination. So that is AI, artificial insemination from the husband or from the donor. The sperm is injected, that is also known as IUI. So this technique is useful for the male partner having the inability to inseminate female or low sperm counts. So this IUI, when it is used, IUI, intrauterine insemination, when it is used when the male partner having the inability to inseminate or the low sperm count. Okay, so that is the artificial insemination. Here, art procedures sometimes involve the use of donor eggs from the another woman, or donor sperm, previously frozen embryos. So this artificial reproductive technologies, ART. So ಇಲ್ಲಿ ಕೆಲವೊಂದ್ಸಲ ಏನ್ ಮಾಡ್ತಾರೆ, if the female is not able to produce the egg, ಫಿಮೇಲ್ ಹತ್ರ ಎಗ್ ಪ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗ್ತಾ ಇಲ್ಲ ಅಂದ್ರೆ the egg is collected from the donor from the another woman, okay, or sometimes the sperms are not produced by the husband, or then uh, the sperms collected from the donor also, okay. Donor eggs are sometimes used for women who cannot produce the eggs. Also, donor eggs or the donor sperm is sometimes used when the woman or man has the genetic disease that can be passed on to the baby. So, this donor eggs or sperms can be used. So, if it is, if the person or the parents, they are having the genetic disease. So, that is also done. Okay. So, that is the surrogacy. Here, what is surrogacy? It is also one of the technique to get the children. Here, a woman bears a child for a couple unable to produce the children because the wife is infertile or unable to carry. The surrogate mother is impregnated through the artificial insemination or implantation of embryo produced by IVF. Here, surrogacy means if the female is not able to produce the baby or carry, okay, female is not able to carry the baby, then the another woman where the IVF is performed, if the female is produced, the mother is produces the egg and the sperm is collected from the donor and IVF is performed, and then it is transferred to the mother who is able to carry the children, okay, and after 9 months the baby is transferred to this couple, okay. So I will explain this. So these are two couples, okay. So she is wife and husband. Here the wife is not able to carry but she is able to produce the egg, okay. So here she is not able to carry the baby, so they will contact another woman, so who is ready for surrogacy. She is called as surrogacy. Here she is okay, then the egg is collected from the this wife and the sperm is collected from the husband and IVF is done, and embryo that is transferred to this woman, and this woman she bear the child up to 9 months. After the parturition the baby is transferred to this couple, okay. So that is the surrogacy. Here the surrogate is impregnated through the artificial insemination or implantation of the embryo produced by the IVF. Here, the IVF technique is also used. This is the another method to get the children. Here, problems of artificial reproductive technologies. What are the problems of these artificial technologies? It requires high precision handling by specialized professionals and expensive instrumentation. So that is cost wise very high, and very knowledgeable and specialized professionals are required, and also expensive instrumentation is required, and therefore these facilities are available only in very few centers, and emotional, religious and social problems are related to this artificial reproductive technologies, okay. Yes, here this artificial reproductive technologies. So here what are the different types of artificial reproductive technologies we have studied? IVF, that is in vitro fertilization, and embryo transfer, ET, embryo transfer. So in embryo transfer there is a zift, zygote, intrapallopian tube, and another method there is a gift, gamete intrapallopian tube where the gametes are transferred. Then ICSI, intracytoplasmic sperm injection, then artificial insemination or IUI, and the surrogacy. So these are the different artificial reproductive technologies, ART, right? Artificial reproductive technologies that we have studied in this class. Very important again. So gift. Hmm. If the male is not able to inseminate, then which reproductive technology is used? When the female is not able to produce the gamete, then which technology is used? So these type of questions will be asked in your exam. ಈ ತರ questions ಅನ್ನ ಕೇಳ್ತಾರೆ. And totally, so this reproductive health chapter completed here. And what are the important things we have studied here? Very important agi. The contraceptive methods, very important for your exam. Contraceptive methods and examples. Contraceptive methods and examples are very important for your exam. Then diseases, sexually transmitted diseases, where viral diseases, bacterial diseases. So that is very important. And symptoms of these diseases, very important for your exams. Then art, artificial reproductive technologies. In art, IVF and ZIFT, GIFT, and artificial insemination, IUI, and ICSI. So when it is performed, gamete intrafallopian tube meaning, right? So meaning ನಿಮ್ಗೆ ಗೊತ್ತಿರತ್ತೆ, ZIFT meaning ನಿಮ್ಗೆ ಗೊತ್ತಿರತ್ತೆ, GIFT meaning ಗೊತ್ತಿರತ್ತೆ. But when it is performed, so IUI, when it is performed, okay? So ಯಾವಾಗ ಅದನ್ನ perform ಮಾಡ್ತಾರೆ? If the female is not able to conceive, so or not able to produce the egg, so which technology is used? When the male is not able to inseminate properly, if the male sperm count is less, so then which technology is used? So ಈ ತರ questions ಅನ್ನ ಕೇಳ್ತಾರೆ. Please be prepared for this type of questions. Okay. Yes. If you have any doubts, you can write down in the comment box. Yes. Thank you, dear students. We'll continue the class in the next session. Okay. Thank you. And don't forget to comment how was the class. Okay. Thank you. Bye bye.